Hello, my name is Dr. Alina Fong, and it is my pleasure to be able to speak with you today. I am the clinical director at Cognitive Effects, just right down the canyon in Provo, Utah. We are a specialty concussion clinic that uses advanced neural imaging, specifically fMRI, to help us with diagnostics and, more importantly, to help us guide treatment for patients that have been struggling with more chronic concussion issues. So what do we do at CFX? Well, our team is very multidisciplinary and focused on many of the different areas that are captured with the fMRI. Our EPIC therapies include, but are not limited to, on the left, neurooccupational therapy, sensory motor training, neuromuscular therapy, neurocognitive therapy, mindfulness, and psychotherapy, Dynavision, neurosensory integration, vision therapy, vestibular therapy, and built-in relaxation and destimulation. In a recent paper, we actually wrote about our theory of prepare, activate, and recover or rest. Each therapy session has a preparation period where there's aerobic exercise, we increase the heart rate, and there's neuromuscular therapy. Then we activate the brain with more of the cognitive stimulation, logic puzzles, memory challenges, motor skills training, etc., multitasking. And then we built in a rest and a recovery so the brain does not become overstimulated. We do that several times in a day over the course of the week, and we are bookended with an fMRI in the beginning and an fMRI at the end. This is a case study with a teenager, 15-year-old girl named Sophia. On the left, this was her scan before any treatment, and you could see her SIS score was 3.71. The higher the score, the more impaired that brain. In the box, you can see that there are biomarkers, and so based on our analysis of over 20,000 scans, we were able to piece out certain biomarkers or common areas that are often dysregulated and captured with fMRI. The 5 main biomarkers that we see are attentional issues, subcortical issues, visual, language, and executive. These are based on Z-scores and range from 0 to 3 and can show quite clearly that if that patient has a score above a 0.8, then they have met that biomarker and they have difficulty in those areas. So for Sophia, before any treatment, we could see that she met 4 out of the 5 biomarkers for concussion with an overall severity score of 3.71. After her 1 week of intense treatment, we were able to scan her again, and you can see clearly in the middle that her score dropped down to a 1.2. She's in the yellow range, which actually is in the mildly impaired range. But you can also see that she decreased her biomarker score in half, meaning that she only has 2 out of the 4 biomarkers that she had previously, just at the beginning of the week, with attention and subcortical issues being her main issues. Even though they are still biomarkers, you can see that her scores went from 1.79 to 0.96 in the attentional range, and 2.41 to 1.69 in the subcortical range. And she reported overall improvement in subjectively in those symptoms. About a year later, we were able to do additional treatment with Sophia, and we can see at the last graph here that her score improved immensely from 1.2 down to 0.05, and she no longer met any of the biomarkers for concussion. So question should be results. Are these patients getting better? Well, based on our objective fMRI data, on the left-hand side, this radar plot shows that their scores before treatment are quite high. Of course, the further out you are, the worse you are. At the end of 1 week treatment, you can see how much these patients have improved. Subjectively, the patient also has to feel good, right? Otherwise, none of this matters, and we can show based on subjective reporting, at the beginning of the week on the left, higher scores, and at the beginning of the week on the right, about a decrease of about 60 to 65% in overall symptom reporting. This shows that overall emotional, the mood component improves the most, then with the cognitive, sleep, and the physical, meaning kind of headaches and balance issues. On this next slide, this shows retest comparisons for no treatment patients and healthy controls. 27 out of 270 PCS patients were randomly selected to compare with 27 patients that have never had treatment, along with 13 healthy controls. On the left, you can see that patients with treatment saw a significant reduction in their overall fMRI scores. Patients with no treatment show random change in that SIS score at scan 2, which we show in the middle of the graph. And then healthy controls remain within normal limits at both scan times and show high retest reliability. And the last question that I often get is, once we reset the brain with our treatment, does it last? On this last slide here, I want to briefly go over some long-term results. We did some longitudinal studies, and you can see at the left side of the graph, that is before any treatment, okay? At the second data point, that is after treatment, which is after 5 days of our intensive treatment. The third data point ranges between 9 and 18 months, where we track patients even after treatment, and we can show that patients continue to get better and their scores and their brain maintains that healthy neurovascular coupling. Thank you so much for your time and listening, and please feel free to contact us with any questions or any patients that you might be interested in sending to us. Thank you so much again.